Hi everyone, my name is Susmita. Today I'm going to give a short presentation on stroke, focusing on ischemic stroke. Let's move forward. So stroke occurs when the blood supply to the part of the brain is interrupted. There are mainly two types of strokes. One is hemorrhagic strokes, which is caused by bleeding in the blood vessels in the brain. About 13% of strokes are all hemorrhagic strokes. And the ischemic strokes occurs when the blood flow through the artery that supplies oxygen-rich blood to the brain is blocked due to the formation of blood clot or the fatty buildup called plaque. Approximately 87% of the stroke accounts to ischemic. According to the Stroke Foundation Australia, here are some of the stroke facts that gives us a broad idea about how dreadful stroke is. Australia's biggest killer kills more women than breast cancer and more men than the prostate cancer. An Australian will have a stroke every 19 minutes. 1 in 4 people globally will have a stroke in their lifetime. Regional Australians are 17% of more likely to suffer than the metropolitan areas. 80% of strokes can be prevented. So how can we diagnose a stroke? We need to think fast. F stands for face. We need to look for the facial drooping. And then A stands for arms. We need to check if there is equal strength in arms. Then S stands for speech. Is there any changes in speech? Do they understand you? And T stands for time. When all of these symptoms are positive, we need to call 000. It is a medical emergency. So let's move on to the case study, pathophysiology of clinical manifestation. Mr. Mark is 68 years old man who had history of hypertension, which is one of the risk factor of stroke. In addition to that, age and gender are other non-modifiable risk factor of stroke. He was diagnosed with left MCA ischemic stroke on admission to the hospital, where blood supply by the middle cerebral artery in the left hemisphere is blocked due to the formation of blood clot. Broca's area presented in the left hemisphere is responsible for speech production and articulation. According to the Stroke Foundation Australia, 1 in 3 stroke survivors experiences difficulties on speech. Incomprehensible words, another name is dysarthria, is one of the clinical manifestations that I have chosen for my case study. It is a speech disorder caused by the disturbance of muscular control. Stroke, this causes changes in strength and coordination of muscles of face, lips, and tongues, making speech sound slurred, weak, and too slurred. In another word, it is speech impairment that can affect pronunciation, loudness of voice, and ability to speak with normal intonation. So here, it is a nerve or brain disease that makes difficult to control tongue, lips, larynx, or vocal cord, which makes speech impairment, changing the ability to eat, swallow, and speak. When there is trouble in swallowing, it may cause food to go down along the airways, which leads to pneumonia, aspiration, dehydration, and many more complications. As a nurse, I have chosen aspiration as one of the high priority nursing intervention that I would apply if a person is presented with a stroke in emergency department. First and foremost thing is to check the airways. If it is patent and clear, we need to maintain clear and open airways for the patient. And the second thing is the person presented with the stroke is to be kept nil by mouth until further notice is obtained from the doctor. And nurses needs to work in coordination with the GP, speech therapist, dietitian in order to take care of the patients. And while feeding, special needs to be considered to prevent aspiration. Patient need to sit upright, like 90-degree angle. Postural changes can be maintained to promote swallowing. We can adjust rate of feeding, in a slow motion, slowly, and then food can be cut into smaller pieces. After giving meal, oral care must be provided. So these are some of the nursing intervention that I would take for the patient presented with a stroke in emergency department. Um, so one thing to be noted is stroke is a medical emergency. So time is very crucial. Treatment within 1 hour of symptoms ensures full recovery, whereas within 3 hours improves chances of recovery with little or no disability. Each minute, stroke destroys 1.9 million neurons and 14 billion synapses. This shows how fast a stroke can damage brain neurons and brain tissues. So it is very important to call emergency and take the patient to the hospital as soon as they show any signs and symptoms of the strokes. So in conclusion, I would like to say that aspiration is one of the important factor that needs to be considered by nurse while taking care of these stroke patients. And then by saying so, I'd like to conclude my presentation. Thank you so much, everybody.